Hi, everyone. We are about to go live with Dr. Ashanda. Let's see if this works. It's always a miracle every time. Oh, hold on. Let's try again. Okay. I'm going to let. Oh, hi.
Hi, how are you?
I'm good. How are you?
So I'm quite new to this. So of course I was on my computer and I'm like, oh no, I have to be on my phone.
It's so funny. I'm telling you, it's you almost have to have a PhD, and then you have to be. And I don't mean that in a bad way, but it is actually kind of tricky. It secretly is. So,
I completely agree. Completely agree. So I
well,
am trying to I have to adjust this so I don't have to hold the phone.
yeah,
Hold
adjust
on.
it.
See?
We got time.
Live TV, live Instagram. This is what happens
No,
live. We
this is
have
good. This is the
to
messy stuff.
exactly.
I love it.
See, real life.
This is
Real
real
life. Hold on.
life. This is what happens.
I think we're good, right? Hold on. Okay. Oh wait, hold on. You see? These things happen. Hold on 1 second. We think we have it and we don't have it. Hold
No,
on, hold on.
it's like two Gen Xers try and do an Instagram live. What
This
happens
is this is
next?
this is menopause, okay?
This
This is
is
menopause.
menopause, 100%.
Hold on, let's
Look
see
at
if
that
I
ring
can.
light. She even has it. This is the best.
Right. Yeah, I
Look
have
at it.
to, I can't let these the youngins take over. We have to do some stuff ourselves, right? Okay, if I could just get this to stay, must be a clamp here.
No, there is a
Okay, now
clamp.
okay, I'm just holding it. It's okay.
You're just gonna hold it? Okay, fine. It doesn't matter. Because you look gorgeous,
Oh,
by the way.
thank you. Thank
Anyway,
you for having me. I'm so excited to talk about menopause. I cannot even tell you.
I have to tell you, I've been telling everyone, and I have so many friends in New York. I'm like, you have to go see Dr. Saint John. She's in Kingston. It's a little bit of a drive now, but go see her. It's true.
Well,
Oh no.
coming back to New York City. So I will please follow me on Instagram, Ashanda Saint Jean, MD, or Ashanda Saint Jean, MD,
Oh,
and you will find where you can make appointments with me. But yeah, so coming back to the city, it's a little cold in Kingston.
yeah. Oh,
It's
you're 100% moving back.
so yeah, it's time to come back to New York.
Okay, this is amazing. Okay, can I do an introduction and just let everybody who's joining right now, because you are such an amazing human and you deserve an amazing introduction. And if I get anything wrong, because it's so long, I literally have to write it out. It's like my board exams because you're so ridiculous. You're amazing. Um, so this is Dr. Ashanda Saint Jean or Saint Jean. Am I saying that right? If I did it correctly? Okay. All
Beautifully,
right.
beautifully.
Okay. She is a board certified OBGYN. She has been in practice for over 20 years in New York City. She was in Kingston. It's too cold. She's moving back to the city, which is hysterical. And Dr. St. Jean is the chair of the obstetrics and gynecology at the Health Alliance Hospitals of the Hudson Valley. She is a professor, associate professor or professor, I mean, you are all things, of the Department of OBGYN at New York Medical College, which is where you got your degree, correct?
Yes,
Okay.
in 1998.
Okay.
Mm-hmm.
Amazing. It gets better, people. We're not done yet. She is the Hudson Valley section chair of ACOG, which, by the way, is a very amazing organization. They are doing incredible things for women's health. She is at the forefront of that. So that's the American College of Obstetricians and Gynecologists. And they are truly I would say, they're on the edge of really ensuring that women's rights, women's medical rights, women's research are being prioritized in this country. So thank you for the work that you and your colleagues do there. She is in District 2, which is New York State. So we love New York.
Yeah.
And in the ACOG district too for diversity, equity, and inclusion, DEI, and you are actually for the national, you represent New York in that capacity as well at the national level.
Yeah.
And she is joining us today. And among other things, she's a champion of women's maternal rights. So even though we're going to be talking a lot about menopause and perimenopause and all of the good stuff around midlife, she's doing tremendous work in maternal rights and really ensuring that these new moms who are coming into the world have the best footing, because it's a little concerning at this point. So anyway, I will pause. Did I miss anything?
No, I think you got it. I think what's important kind of for our topic today is I have had to become a champion for menopause and perimenopause because of my own
Yeah,
experiences, right? And so what we all have to realize is we are all aging.
yeah.
And when that first hot flash hits you, you get it.
Oh
You
yeah,
get it. And I think I got it when I had 56 in 4 hours. I started
yeah.
counting them. I could not believe
No.
it. Oh yeah. Oh yeah. Oh yeah. And that's when I think this is what a lot of people feel is like, first you feel palpitations in your heart.
Yeah,
We always are fearful about heart disease. Am I having a heart attack? You start
yeah,
profusely sweating.
yeah,
It's like a heat wave that hits your body. It's a myriad of things that happen. Your hair gets thinner, your skin gets dry,
yeah,
and you're like, wait a second. Am I going through the changes? And, that made me become a champion about menopause. It made me want to talk about it because I know whatever I'm going through, someone else is going
yeah.
through it. And it's time to throw the stigma, the shame outside the door. We are all going to get older. We are all aging.
That's right.
But I think us as women, if we talked about it, if we normalized talking about it,
Yeah,
if we said, look, yeah, I'm getting older, I'm going through that change, I think that would come, number one, we'd have more information about it.
yeah,
We talk about the options.
yeah.
We know that there's treatments and solutions instead of feeling like shame and I'm getting older and guess what? I just have to deal with it.
Yeah, I mean, I think that we are the generation that took back pregnancy in many ways. I remember my grandmother saying she was literally just put out. I mean, they just put her out and then she woke up and then she had a baby. But she had no relationship with her own birth. And
Yeah.
so I think that we as a generation have taken that back and said, no, no, I would like
Hmm.
this part back and this
Yeah.
journey back. And I'm in the driver's seat. So I'll be deciding and making decisions for me. But I think
Hmm.
that it begins with understanding and having an education and even a baseline understanding of what's happening. And I think, you and I have talked about back and forth about what we want to talk about today. And I think a lot of women don't even know that they're going through perimenopause. It's a word that truly just,
Hmm.
now you're hearing it every day, but mothers didn't talk about it. My grandmother certainly didn't talk about it. Nobody said anything that there would be this somewhere between 2 to 10 year situation. And you talked about it,
Hmm.
but can you give a really clear definition of the stages and how long they last and
Yeah.
how are they defined?
Yeah, so it's very important to understand that this is different for everyone,
Mhm.
right? And so I can't give you exact norms, but when we talk about menopause, menopause means no period, so no menstrual cycle for a complete year. So if you are still having a period, whether it's every 3 months, every 6 months, every 4 months, you are then in that perimenopause. You haven't had an absence of periods for a year.
Yep.
Now, even though you're having periods and although they may be irregular, you can still have hot flashes, you can still have night sweats, sleep disturbances, you can have mood swings, you can have increasing, you can
Yep.
have, what are they, dry skin, hair
Yeah.
loss, weight
Itchy.
gain. You can have the weight gain in your abdomen, right? That we all loathe, right?
Yep.
And
Yep.
so the distinction between perimenopause and menopause is just whether you have the presence of periods whether it be irregular or you haven't had a period for an entire year.
Yep.
You can have the same symptoms in both. And, you know, I just want to share, do you know how many women go to the emergency room thinking they have panic attacks or heart attacks because they're having hot flashes,
Yeah.
because they're having
Yeah.
palpitations, because they have increased anxiety? Some have patients that just say, I want my life back. Like, what's happening to me? And sometimes they have to, what we call doctor shop, because they'll go to one doctor, oh, you're fine. Or go see
Yeah.
a psychiatrist, or go see a psychologist, go see a mental health specialist.
Yeah.
Nobody wants to check their hormone levels or just listen to them.
Yeah.
Part of doing this work is just listening. What, you know, having that time and that support to say, look, this is what I'm experiencing. I know this isn't normal for me.
Yeah.
I have changed. Can you help me?
And women know their bodies so well. I mean, I think that again, um, this is a blanket statement, so I'm just saying, I feel like women know when I feel right and when I don't feel like myself and something is happening. And oftentimes we can't put words to it. And so I think that with language and vocabulary, it's
Mm-hmm.
really important because then women can understand and say, yeah, you know what? I've been having ringing in my ears. I've been having
Mm-hmm.
increased anxiety. It happens when I drive. Like all of a sudden this is happening at night. I'm sweating through two pajamas, like I'm drenching the bed, but giving them the language to then be able to advocate for self, to put words to that feeling that I used to feel this way and now I don't feel this way, something's wrong, helps your provider say, okay, well, those are classic symptoms of perimenopause.
Mm-hmm.
So here you go. So you don't end up in an emergency room with heart palpitations. And we're going to talk about vasomotor symptoms later on and making sure that you understand that connection between your heart palpitations and perimenopause and what's actually happening. So, okay, so 365, I don't have my period. I'm officially, that's it. It's shut down. What has happened to those ovaries?
Right. And so it doesn't mean that the ovaries are not working at all, right? So there could be like little kind of signaling that allows them to kind of one, you do not have the ovulatory function. So that just means that you are not producing eggs. You are not um, capable naturally to get
Get
impregnated, to get
pregnant.
pregnant, right?
Yep. It's done.
But also with the, yeah, so
Just
so
saying.
sometimes my patients like to say the factory is
The
closed, right? I've
factory is
graduated.
no more.
Commencement has happened. I'm done, right? So yeah,
Yep.
so that patients come to me and they're like, you know, I still do a pregnancy test when I don't get my period. And I'm like, oh, okay. Um, all right, all right. Or I have patients who will say, I haven't had a period in a year, but I still, you know, I want to keep that IUD in, or, you know, I want birth control. And I'm like, okay, let's talk.
Yeah. Yeah.
So
Let's
I think
explain.
part of,
Yeah.
yeah, part of what you're saying is education, right? Giving people the tools so that
Yeah.
they can self-advocate, because a lot of times, you know, sometimes doctor's appointments, they give you the 15 minutes. Part of that 15 minutes, 10 minutes is the vitals, or you're waiting in the room. And then it's like quick, quick, quick. And they want, you know, they want to leave. And patients don't feel that they're
That's right.
heard, right? And so, you know, what I always tell patients is that, you know, it may not be something that they can address in the annual visit, but schedule another
Yeah.
appointment. And when I educate providers, you know, in ACOG webinars and podcasts, right? And one
Yeah.
of the things that I kind of train providers in the tools is I call them icebreaker questions. So
Right.
icebreaker, pun
Yeah.
intended, right? Because if you're having hot flashes, you want an icebreaker.
Cool
And
down.
one is, yeah, a cool down. And one is ask this one simple question: are you having hot flashes? You know, two, are you having problems sleeping?
Mm-hmm.
Three, do you want to talk about it?
Yeah.
That's it.
Yeah.
And I think that opens the door where a patient will feel safe. That's kind of a bridge of trust, that you can talk about something that society has deemed shameful, and that's aging, which we are all going to age.
Well,
It's
and
just the reality of it.
how lucky are we? right? I mean, I think it's such a beautiful notion to say we got to this point, and we're very few mammals on this planet that actually live long enough to be in menopause.
Mhm.
And what a gift. I mean, grandmothers, I mean, not that I'm a grandmother, but like that
Mhm.
generational transition matters, and
Mhm.
women live longer, and we get to be present and provide in different ways, which is such a gift. Um, okay, can I go to vasomotor? Because I feel like
Yes.
it's one of those, that was my first symptom,
Mm.
was night sweats, where I felt like I was swimming and maybe, I mean, drenching the bed.
Mhm.
Can you explain what they are
Mhm.
and what can women do about them? And then specifically, are there safe and effective treatments that women can advocate for and explore?
Yeah. So vasomotor symptoms are symptoms where like your temperature control in your body, your internal thermostat is just not working the way it used to. And so hot flashes they are kind of like waves of heat. Now
Mm-hmm.
they go from mild, moderate to severe.
Yeah.
They can happen between any time of the day and night. They often happen specifically and most oftenly at night, which then can disturb your sleep. And so patients or people will remark that they wake up, they go to sleep, they wake up, go to sleep, covers on, covers off, covers on, covers off.
Yeah.
And then also sometimes they have to sleep with a fan.
Yeah.
It's interesting. Amazon has this very interesting menopause kind of storefront.
Uh-huh.
And so you can buy cool sheets, you can buy cool blankets. I remember when I first started having them, I had an ice blanket that I would put in the freezer. At night, I would put it over me. My husband thought I was
Uh-huh.
crazy, but that was the only thing that allowed me to sleep at least for 3 to 4 hours. And
Right.
what's important about is that often many of us still have to go to work, right? We still have our
Yeah.
families to take care of. So
Yeah.
when we don't get sleep, but we still have to perform and carry out our daily activities the
Yeah.
next day, it is very, very difficult.
Yeah.
As a physician, I would have to still do surgery, and again,
Right.
I would still have to see patients, deliver babies. And it is not fair to our patients if we're not on our best.
Yeah.
One of the personal stories I always like to tell is, I'm kind of one of those dorky people. I would write down my dreams, and I
Yeah.
had a dream journal. And so I wake up in the morning, whatever dream I
Yeah.
remembered, I write it down. I had a dream dictionary. And when I started going through menopause, and it wasn't until I started treatment and I started dreaming again, I realized I did not enter anything in my dream diary
For that.
for 18 months.
So interesting because you never went into a dream state.
Right. So there's no
So
REM
fascinating.
sleeping.
Right.
So that's the thing. So you're not really restoring your body during the night because you're up and down, up and down, up and down. And we don't always talk about how this may disrupt relationships.
Yeah.
Sometimes partners may not be able to sleep in the same room because you need it to be an ice box, regulate the
Yeah.
temperatures, because those are often a thing as well. So, being mindful that menopause can change so many different things, not only the person,
Yeah.
but their relationships, their interactions,
Yeah.
their sleeping habits, what that does in kind of a home, so that's a big, 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 big deal. And
It's a
so
huge deal.
yeah,
Well, and I feel like so many people have that story of,
when
you want it cold, your husband's snoring, so he's on a CPAP machine, you're sweating. It's like it's such a mess. It's a total
Mhm.
disaster.
Yeah,
And what
yeah.
happens is you start to fray. You know, I mean, we sleep for a reason. That
Mhm.
restoration period, that molecular, what happens when our bodies rest. We had a conversation earlier this week with Dr. Marissa Chapman about
Mhm.
skin health and aging, and she said, yeah, sleep is a critical component. And I was like, oh god, I mean, here we go, my skin
Mhm.
is rejuvenating at night. But it really has these impacts. And so I think, to address it, there are safe and effective treatments for these symptoms.
Mhm.
And I think that many women don't know that, and they could just continue to just slog through it and suffer and figure, well, it'll be over some time. But to your point, 18 months of no REM sleep, is detrimental. Like it's really important to advocate and see if any of these options are. So menopause hormone therapy, for example, tell us about it.
So, in 2002, there was a study called the Women's Health Initiative, and it was
Mhm.
out of Boston. It was a lot of nurses that were involved in it. And again, what they were exploring was hormone replacement therapy.
Yeah.
Well, there was a lot of problems with that study. However, that study was prematurely stopped because they were seeing a high increase of cancer, cardiovascular disease, stroke, or just kind of blood clot
Hmm.
disorders like heart attack or stroke. And so when that stopped in 2002, we stopped talking about hormone replacement therapy in this country for 20 years.
Yeah. For an
So
entire generation.
basically, yeah. So the thought was, just deal with it. It'll be over
Hmm.
soon. You'll just have to, just struggle through.
That's
And
right.
I think what happened is that, we did not investigate the flaws of that study. And
And there were
what the
many.
flaws in that, many, one of which was most of the participants were older than 60, between 60 and 69. So they already had predisposing conditions that made them prone to all of those kind of conditions that I named before.
Yeah.
But again, because they were in a study with HRT, with hormone replacement therapy, which we really call hormone therapy now,
Yeah.
that was kind of attached to
Yeah.
it.
Yeah.
So again, when we talk about shame and stigma with just menopause in general, there was shame and stigma with with hormone therapy.
Yeah.
And so it was basically a cast it out. It was a scarlet letter. It was gone. It was erased. Nobody discussed it. It wasn't taught in like residency programs.
Yeah.
It wasn't something that you dealt with. And, I think one of the things when I started going through this and I looked at the studies, right? And so there's one called the SWAN study, which is really kind of instrumental because it really had a diversity in terms of different races, ethnicities, and it looked at kind of all of the symptomatology and the impacts of menopause across race, ethnicity. So,
Yeah.
of Black race, of Asian,
Yeah.
everything. And, one of the things that horrified me when I first started going through menopause was that I can have a transition between 2 and 11 years. And
Yeah.
I said, are you kidding
I know.
me? And I called my mother and I said, Ma, when did you go through menopause? And she's like, I'd have to think about it. I'll call you back.
Yeah.
Because again, it wasn't
Yeah.
discussed. You just kind of dealt with it. I always tell the story of, working in the hospitals in New York City, and I had a midwife I worked with. And during the night, whenever she would have to present a patient to me, she would be chomping on ice. And I was just like, one day I was just like, are you anemic?
Yeah.
Do you have fibroids? Like, how we doing? Are you okay? But she was having hot flashes, and that's
Yeah.
how she dealt with it, is she just ate ice.
Wow.
And I was like, there's other things we can do. Like there's
Exactly.
other
Well, and
ways.
so I mean, to that end, you can suck on ice. That's your prerogative. But they have walked back so much of
Mhm.
that WHI finding and have said, I mean, obviously there are still some contraindications, but for most women, the majority of women who are in perimenopause and menopause, there's no question
Mhm.
that hormone therapy for if for those symptoms is tremendously effective. So
Yes.
I think for
So
anybody who's
so
listening, advocate for yourself. Ask if
it
it's
is
right
it's
for you.
important for you to have conversations with your providers,
Mm-hmm.
but know that, if you do not have any contraindications, and those are medical conditions, and I can name a few if you want, but I would, prefer you have those conversations with your
That's
provider
right.
who knows your medical history. However, if you are a candidate for hormone therapy, it is extremely helpful. It's life changing, it's transformational. And I'm going to tell you, it gives a new lease on life to so many of my patients. They were like, I wish I would have done this sooner. I wish I would have not listened to all the things out in the universe that say how bad it is, even though it is life changing.
Yeah.
And so that's the important part, is that there are tools. And even if you're not a candidate, right? So if you have one of those conditions where we can't give it to you, right? there are other things that we can give
Right.
too. So this is
Right.
why it's important to have that education, have that knowledge, have this toolkit that you're getting today. Go to your doctors and say, look, this is what's happening to me. How can you help me?
That's
Because
right.
there is help available. This is not a day where you need to just suffer in silence or you suffer to no end.
And just, I
There
think
are,
women are taught to just suck it up, right? We have our children
Mhm,
barking at us and aging parents barking at us and a partner and a pet, and everybody
mhm,
wants something from you. But, you know, that old adage of put the oxygen mask on first, you have to do it. And I think
mhm,
there is hope, there is control. There are levers that you can pull to
mhm,
help transform a suffering state that, again, can last anywhere from 2 to 11 years, and it doesn't need to be that way. And so I think that just knowing that is such a tremendous gift, that there's something you can do. So okay, here's a question for you.
mhm,
Top, I would say, tips for women who are listening of
mhm,
lifestyle changes that they can make to
mhm.
support themselves during perimenopause and menopause.
Yeah. So there's a few things. Are phytoestrogens. So phytoestrogens mean they're natural occurring estrogens. So there's some foods that we have that already have the estrogen in it. And so you can eat a little bit more of those foods or add them to your diet. That
Mm-hmm.
number one can help you. So when I say phytoestrogens, it's PHYTO estrogen, phytoestrogen. And so some of those are number one, anything, any soy product.
Yeah.
So there are different communities that don't have as many hot flashes because their diets are fortified in phytoestrogens.
Mm-hmm.
You can hear me, right?
Yes.
Okay.
Yep.
So soy products can include tofu. It can include soy milk, soy cheese. It can include edamame. I have a patient who goes to Trader Joe's and just buys a bags
Those
of
are,
edamame and just, that's her snack throughout the day.
well,
Okay.
I think that
So,
Dr. Saint Jean, it's one of those things where you, I think you hear a lot of like, oh, you could do this and that, but soy really is the only the only food source that has had so many studies, really, really well done research to say there is a connection. So
mhm.
it certainly is important if that's something that you would like to explore.
And so,
Can you hear me?
yeah, now okay. I don't know what is going on with this
I don't
phone.
know.
Okay, but you can hear me, right?
I can
I'm
hear
good.
you. Yeah.
Okay, wonderful. So then also about flax seeds, so
Mm-hmm.
that you can add that to your smoothies, to your oatmeal. You can add those to your shakes. That's also, they come in, just small seeds. You can buy those in the store. Green tea has a lot of phytoestrogens in it. Also, you can do, um, okay, what am I thinking of? Oh, sweet potato, yams.
Yeah.
So
Yams are great.
again, we always think of, starches, they can be highly caloric. And so we're worried about the weight gain that happens because our metabolism has slowed down. And then we're packing on the pounds in the midsection.
Yeah.
Into 7 and they have a piece every
Yeah.
day, right? Or sometimes they have a piece twice a day. So there's certainly those things that you can do. Also, there are, exercising, weight reduction. We know that a Mediterranean diet,
That's right.
there's a whole documentary on HBO about centurions that live in Greece, right?
Yeah.
There's
The blue
islands where
zone.
people are over, yes, over 100 years
That's right.
old. So we can learn
We
from
can
them, okay? So
learn a
this is
lot. And I think, again, nutrition is one of those levers where if you think about the things that you can actually control, it's Heart Health Awareness Month this month. And when you talk to cardiologists, they say, 80% of heart disease can be reduced by just things that you're doing in your daily life, right? So nutrition is one of those things. To your point, whole foods, tons of fiber, right?
Mhm,
Eating clean. We know what to do. I mean, we're smart. Women are smart. You know
mhm,
what you should eat. You know what you
mhm.
shouldn't eat. Um, but those are great, great choices. Okay, you were saying exercise.
So exercise, so you want to do more weight bearing. Tai Chi, those Pilates. So, you don't need to do as much cardio in this kind of,
Right.
kind of chapter in your life. But doing the more weight, kind of the weight bearing exercises would be helpful. And then just staying active, right? And so those are the things that you want to do, whether it be a walk or even, you can do a speed walk,
Yeah.
knees, because another thing we didn't talk about that happens in menopause is you can get joint pain.
Yeah. A
And a
lot.
lot of people have knee pains, and they'll say even also the knee pains is worse at night.
Yeah.
I have some patients who have to put a pillow between the knees because
Yeah.
they're just like, I don't know what it is, but my knees ache at night. So, we want to be mindful of that. We always want to be careful. We don't want to do exercises or activities that could danger our bones
Yeah.
because we know that one of the effects of menopause and perimenopause is bones. And so you can get a fracture a little bit easier than when you were 20 years old. So, you want to think about that when you're doing those vigorous exercises because it may not be something that's the beneficial for you. It actually may be harmful for you.
Yeah, and I think that notion of the muscular skeletal importance during this, imagine 1/3 of your life and ensuring that you're prioritizing your muscles because your muscles and your bones are like two sides of the same coin. And that muscular skeletal framework is so important to your longevity and then living in good health, right? Like, can you carry things? There are many studies that showcase, can you open a jar, right? That are predicated on how well you will age. And so, I mean, I told my mother, I was like, you need to start doing weightlifting. And she's in her
Open that
70s.
peanut butter right now. Open
I was
it now.
so bossy. I was like, Mom, you have to start going to a trainer. Have to start weightlifting. And it's important. I was like, you need to do farmer carries. And it's not too late. I think that the prioritization of making sure that she has strong muscles to support her bones. And again, I mean, the facts way more than I do, but you break that hip and it is not good. And
Mhm.
so it is really important for women to understand that your bone health, and again, this could, we can talk for hours about hormone therapy and it's real tremendous benefit that they know on osteoporosis and bone density and bone health. But prioritizing that is such an important part of this longevity. If we're living this long, we need to live in good health. So those are great. I love those.
That you want to take calcium, right? And so some patients are like, I don't want to take those big calcium pills. And this is why they have them in the chocolates. They sneak them in that dark chocolate. And sometimes those can be expensive,
Right?
right? And so how else can we take calcium? Well, guess what's in calcium? Tums.
Yeah.
Just go over to the
Pop those
Costco, get
tubs.
that. They come in a whole different, I was like, take 2 of those twice a day. There we go.
Yeah.
But
Well,
you want to get that calcium.
yeah, and the connection to vitamin D, right? Like that connection of vitamin D and calcium together. A lot of people don't. The relationship and the absorption is really important. So making sure that you're talking to your physician about and getting measurement, whether it's a DEXA scan or your vitamin D levels getting checked. It's really important to have those baselines so that you can, again, it goes back to what we've been saying is this advocacy and being educated about where you are so that you can say, I need X or I need Y.
Yeah.
So
And I think we don't think about there are saying kind of the fragility of your bones, right? And then there's osteopenia.
yeah,
Osteopenia is basically pre
right,
osteoporosis, right? And so knowing that number one, if you have risk factors for osteopenia or osteoporosis, you want to get started earlier for your screening
yeah,
done. So if you have a relative, first degree relative, like your mother, or someone who has almost like what we call a curved back, right? Or,
right,
if you're fair skin, these are all risk factors. If you're a smoker, right? Or if you have certain medical conditions that may
right.
predispose you. So, or if you had taken certain medications. So being mindful of that in the United States, we have such a high deficiency of vitamin D.
Yeah.
And so people are like, I go outside all the time, right? And then you check their level and it's like below 30. And they're like, how could it be? And I'm like, yeah, this is what happens. And
Yeah.
so this is why we have certain vitamins for older
That's
generations,
right.
because it is more fortified with calcium and vitamin D. And what we have found, and again, this is something that has been more kind of a nuance than when I went to school
Right.
over what 20 whatever, a lot of years
Don't
ago.
say it. Don't say it.
But we found that the impact of vitamin D deficiency, it impacts all your organs.
Yeah.
And so once we replete that, right, and we resolve that deficiency, our patients, they feel better,
Yeah.
right? And I'm going to just tell you, me included, I'm one of those people like, yeah, I'm fine. I go to the beach, I get a suntan. Wow.
Yeah.
So it's all of us. And so we want to be mindful of that. And when we think of opportunities to feel better, right? So, it's the sleeping aspect. Now, another thing that we didn't really talk a little bit about, I would like to, if it's
Yeah.
okay, is genital urinary symptoms of
The
menopause, right? So we talk
GSM
about the base.
ladies. Yeah. GSM. Get your pencil out. This is a good one. So what is GSM?
Other concern our patients have, and I don't know how free I can be, but they will
Free.
complain about it. Oh,
You just bring it. Whatever you want to
but
say.
they can have vaginal dryness,
Yeah.
or they can have recurrent, so that means frequent urinary tract infections. And they're
That's
like,
right.
what's going on? The best way one of my patients said it is, my whole life I never thought about my vagina. Now I think about it all day long because
Yeah.
it's either it's either burning or it feels dry.
Yeah.
Trust me, patients will try a whole assortment of things. And, there is capitalism that's happening in menopause
Yeah.
because they go to CVS or the pharmacies and they buy all sorts of things. And they're like, sometimes I have patients bring me, like, they have a bag full of items and they'll just put it on the table and, like, I'm using this, and this. I'm like,
What are you
well, they say it
right?
works. And I'm like, huh? And they spend a lot of money
Yeah.
on these things. And so sometimes it's not the lubricant that you need, but you may need vaginal estrogen. So when we think about genital urinary symptoms, that could be vaginal dryness, it could be, you know, discomfort when you have intercourse, it could be, repeated urinary tract infections, or just overall redness, soreness, dryness, it just burns, it hurts,
Yeah,
you
and I
know.
think one of the best descriptions I've heard is, everything's drying up. Your eyes are drying up, your skin is
Mhm,
drying up, and of course, your vagina is drying up. And if you think about how you want it to be this like juicy grape, but it's becoming a raisin. It's true. And how do you get back to a juicy grape? Vaginal estrogen therapy, that topical localized therapy
mhm,
is bringing those cells back to life in many ways that I don't think that many women understand, not just the importance but the efficacy.
mhm,
And they have walked back so many of the scaring tactics, that big black box warning that's still on there. We are trying to get that removed because
mhm,
we know how safe vaginal estrogen therapy is for all. I mean, it's just unreal. And again, it's not just for vaginal dryness, but to your point, it's the UTIs. Women who have chronic UTIs,
mhm,
that's a risk. It becomes a health
mhm.
risk ultimately.
And we know if a UTI, so a urinary tract infection, a urine infection, if that's
Mhm.
untreated, that can then move up to your kidney, right? And that could
Yeah.
also require you to be hospitalized. That can go into your bloodstream and cause sepsis, right? And so when we think about it, it's an easy fix, right? And one of the things that I explain to patients is that vaginal estrogen is local. It's not
That's right.
systemic. It's not going to go through your whole body. So even my patients who have breast cancer, who are on chemo, I can give them vaginal estrogen. I have a 90-something-year-old who is on vaginal estrogen. So this is also one of those things that can destroy your quality of life,
Yes.
right? And we have to also remember in this country, when do most divorces happen? They happen If you look at that and look at the intersection of perimenopause and menopause, these are when these things happen, right? And so I've had patients who confided in me and say, look, I love my husband. I feel so bad for him. I haven't had sex with him in 4 years.
Right.
And
Right.
I'm like, let's, at first, I always say, thank you for trusting me. And I said, do you know
Yeah.
how brave it is for you to say that to me?
Yeah.
So I appreciate and I thank you for trusting me. Now let's talk about how we can fix it.
Yeah. And
But I,
no, I was going to say that is really the message that I think that you have brought to the forefront today, which is thank you for trusting, and really sharing what so many physicians hopefully are watching you and modeling, which is this openness, this genuine, authentic approach to saying, I'm hearing you and I'm seeing you, and there's something that I think that we can do about it. And I think that that is so tremendous. And it's going to take all of the physicians that we know to help the largest growing demographic in this country transition to, through perimenopause and menopause. Oh, did we lose you? Anyway. No, well, you're back.
wait, hello?
Hi.
Yeah, I don't know what is going
I
on with my,
don't know. Maybe
I have
it's like
all the
fading in and
bars,
out. Okay.
but the funny
Well,
thing is, are we allowed to say where we're at?
yeah, you can say where you're at.
I'm in New York. Where are you?
I'm in Palo Alto, in
I
California.
know. Huh?
And I'm in California.
No, that's what I'm saying. You're in the beautiful California. I don't know if it's the snow or whatever's happening here or the cold weather, but it's messing with my
So you know
Wi-Fi
what?
here. So I
We're gonna
apologize.
do another one anyway because I feel like we've just scratched the surface, and
Yeah.
your impact and your perspective and the years that you have been practicing medicine and your advocacy at you know in um, with other physicians and making sure that within obstetrics and gynecology that doctors are well versed and educated and are supporting their patients in a way that, to your point, 20 years, an entire generation was missed. And so how do we make up that time? And the work that you're doing is so tremendous, and we're so grateful for you. And so we will put all of your information into our Instagram, and we are going to send, where can people find you as we wrap up?
They can find me on LinkedIn
Mm-hmm.
or Instagram. It's the same handle, so Ashanda Saint Jean MD. And the thing about it is, I wanted to just add to that is that you need to have validation, right? And again, I think you said it earlier, nobody knows your body better than you. So if you are feeling that, if you're having those symptoms, it is happening.
Yeah.
Do not let anyone, I don't care what color, how many initials they have behind their
Yeah.
name, or what kind of white coat they wear, right? You deserve to be
Yeah.
heard. You deserve to be respected, and you deserve to receive treatment or even be afforded the option of the discussion about the assortment of treatments that are available.
Yeah.
It's not a one size fit all. I always tell my patients, I said, I may not be able to fix it, but if you allow me to walk down this journey with you, hopefully we'll arrive at a solution that is acceptable and that will resolve how you feel and get you to a better quality of life. And that's usually what I say, because this is not easy. And
No.
I know that because I go through it. And to be able to unpack that to someone you don't know
Yeah.
after you just disrobed yourself or had the most invasive
Yeah.
so people don't understand, going to the GYN, no other besides, I guess, GI, but even there you don't get completely naked
Mm-mm.
from head to toe naked.
Yeah. No, no, it's an extremely vulnerable
Mhm.
um, conversation. I think having physicians like you on the other side of the room just helps facilitate a much more productive and ultimately beneficial engagement for the patient, right? Having somebody where you feel safe, that you feel heard, that you feel like you can go action and that you're in control of something, and somebody's going to partner with you and advocate for you. And that ultimately becomes what healthcare should be, which
Yeah.
I'm just going to zip my lip on other things that we could work on There's a lot of work to be done. But it is doctors like Dr. Saint Jean who are just tremendous, and we are so grateful for you. So thank you for all that you do for women.
Oh, listen, I think that what we need to understand is that there's a woman in our lives. We have a mother, we have a sister, we have a daughter, we have an aunt, we have a cousin, right? And so there is someone, if we are not affected by it, someone's going to be affected by
Right.
it, right? And we can be helpful, but we can be empathetic and we can be
Yeah.
compassionate because nobody wants to go through this.
No,
There's nobody. All
no.
right. And I think that once people have a disturbance of sleep, that's the game changer. Like usually that's the breaking point where they're finally seeking out help
Yep.
because the sleep has been disturbed. They'll take the hot flashes, you
Yeah.
know. I'm telling you, I literally, and uh, I've literally been in surgery and I'm like, can you do me a favor? And they're like, huh? And I'm like, can you get get a glass of ice and just put it
Yeah.
down my back?
Yeah.
And they're like, huh? I'm like, just put it
Just
down
do
my
it.
back. Because if you
Put
don't
the
do
ice
that,
on
I'm
my
gonna
back.
pass out. Because in the OR you have the hot lights,
Right.
you in the gown, you have the gloves, and sometimes you just need, a cup
A
of ice down your back.
cup of ice down your backs. That, ladies, is takeaway. That's amazing.
Well,
Um,
I can tell you this. I went to school in New
yeah.
England. And so high school. And so always loved wearing turtlenecks and
Yeah.
sweaters and all those things. And they're in my closet. And I look at them and I said, one day we'll meet again.
But not
Not
right now.
anytime soon.
Yeah. Oh my God, I love it.
Those days are over. But I was like, I'm keeping you
Just
because
in
I think one time,
case. One day I'm coming
one
back,
day we'll
girls.
meet again.
Okay,
But
well,
I want to come back to you.
one day you and I are going to meet again because we're going to do this again because I feel like we scratched the surface and there's so many things we just have to keep getting out and proselytizing and sharing because so many women will benefit from hearing you and your incredible wisdom. So we're so grateful for you. And thank you, Dr. St. Jean, for everything. And we will put all our information in HotPause Health in the wrap up. And you're amazing. Thank you. Thank you.
Why, thank you so much. Thank you for bringing this to the audience. They need to hear this. Thank you.
Yeah. Okay. Big hugs. Talk to you
Bye.
soon. Okay, bye.